Today I'm going to show you the way that I use to perform the treatment with Perfill. In this case, I'm going to use high weight. With Perfill high weight, I'm going to get a very important hydration of the skin and a very powerful collagen stimulation. In the following video, you will see not only the way that I use to perform this kind of treatment with Perfill, but also the easy way to extract the product from the vial. I hope this video is very useful for you. Thank you. Step 1. The extraction of the product from the vial. For this step, I'm going to use 18 gauze extraction needle, and you're gonna see how easy it is to do it. Remember that I kept my vial upside down approximately 35 to 40 minutes before performing the treatment in order to allow the gel go down inside the vial. So you just introduce the needle in the vial and extract slowly to avoid the formation of bubbles inside the syringe. If you want to make it easier, you can inject air inside the vial, and it's going to be even easier to extract the gel from the vial. So now I have my syringe full with the product, in this case Perfill high weight, and I'm ready to start performing this wonderful treatment in my patient. First, I'm going to mark the hand and the places where I'm going to make the entry points and the lines that I'm going to follow in the fanning retrotracing pattern with the cannula. Then I'm going to make the entry points with a 25 gauze needle. And I'm going to introduce my 25 gauze cannula. You can see how the cannula entry very easy once you are in the right place, in the right layer underneath the skin in the subdermal plane. The cannula just slide under the skin, and because you are using a cannula, you are dissecting the plane, and it's very safe. You're not going to cause any damage to the vessels, to the blood vessels. So you go forward and deliver the product in the subdermal plane, and it's very easy. In some places you're gonna feel some resistance, but it's easy to move forward just with a little pressure in these points of resistance. So as you can see, the use of cannula for this kind of treatment is perfect and is so easy. You just slide underneath the skin and deliver the product. I repeat, it's very safe, and it's like butter. It's like sliding in butter when you are in the right place. So you are providing a very, very high hydration and restoration, biorevitalization, and collagen stimulation. Meanwhile, you are creating
filler effect that is going to help the hands to look very, very young and very, very beautiful. Then I just cleaned the surface of the hand and made a soft massage to help to integrate the product and the plane that I treated. I used a total of 1.5 cc in each hand. Now in the neck, I mark the border of the mandible, and in the same way as in the hands, I mark the lines for the fanning retrotracing. I make the entry point and introduce my cannula, 25 gauge cannula, and deliver underneath the skin in the subdermal plane. Very, very easy. The product, and I'm using in total 2 ml in the neck. And as a bonus track, I'm going to show you the way that I use a mesodermal needle, in this case a 27 needle, for the treatment point per point. I'm going to inject this area where she has a scar of thyroidectomy. So you just create a little papules in the skin, and it's so easy too.
Now you will see a wonderful before and after of this treatment. So in total, to perform all the treatment, the both hands and the neck, I used 1 vial, 5 ml of Perfill high weight, and is the perfect amount and is enough for this kind of treatment. Once again, I hope this video is very, very useful for you. It's always my pleasure. Thank you very much for your attention.